Hi YouTube, it's Kim, BK Shea 2001. I made a video 2 days ago. I'm making a new one because I went to the plastic surgeon today. This is my second video of doing this. Apparently I talked too much at 10 minutes, so I'm going to try and make this quicker. I went to him to talk about breast augmentation, implants, and abdominoplasty tummy tuck. And I was very impressed with him. He was very professional. I really was comfortable with him. I had a lot of positive feedback on him through multiple other doctors along with a few patients. So I was pretty impressed. And they do them there in the office. In some incidences, the insurance company requires a hospital. So I don't know what my insurance will require at that point. So we're doing a prior authorization for both. They will not be able to do the implants. He only wants to do a breast augmentation and the abdominoplasty tummy tuck. And after 3 to 6 months of the healing process, then we will do the implants. He does not want to put them together. There's too much issues. I don't know. So anyway, I went from a 56 double D and I am at a 34 C, and that is putting them in there and trying to get them positioned right, and they're all wrinkled up top. That's how much I've lost. I could pretty much lift them up and fold them if I wanted to. That's how bad they are. I had no clue, but apparently my belly button is off center and to the left, and it's obviously with the weight loss in the stomach, it's wrinkled and covered up. So he's going to fix that. And you get a new belly button. The stitches that they do, well, they do a complete lower cut, and then they pull down on your stomach and then pull up on the lower part. And so basically what he was showing how much skin will be gone is probably about 10 inches of skin in my stomach area. I have no idea what the pounds will be on that. And that's me just looking at it. I mean, he didn't give me the exact inches. He just showed me what would be gone. On the inside, he'll be pulling in, and so then there will be stitches on the inside under my skin of what he's pulling in. He was impressed with the amount of weight loss that I've had and without the complications that we can all sometimes get. And he was impressed with how little excess skin he said I have compared to a normal large amount of weight loss in a short period of time. In fact, he made the comment of, your sides look really good. They're really smooth, and that's really good. And who gets those compliments? It's just funny. I'll take them because, in the past when you're a big girl, you had all the negative comments from a doctor of you need to lose weight for this reason, this reason, this reason. And so it was really cool to, even when you're removing excess skin, have something positive to say. It was nice. Did you notice I'm back on my laptop? I'm so excited. So anyway, that is what we're doing. When I do get the implants, you have the option of gel or saline. Saline, of course, has been around forever. Gel was around way back when, and then the FDA pulled it and said that they weren't sure if it was causing autoimmune disorders. And so they immediately pulled them off of use for people like me and you. But the cancer patients, breast cancer patients, were still using them and were by law allowed to use them. So what happened with that was in this last 20 years, they had done a study of those breast cancer patients that used the gel to see if this was in fact true, a autoimmune disorder caused with a leak of the gel. Not one case came back positive. So as of 4 years ago, and we're talking thousands of patients being studied with the gel implants. Thousands. So as of 4 years ago, 4 or 5 years ago, they brought the gel implants back. I am tending to lean towards the gel. They have more of a natural feel to them versus the saline. Also, if or when there is a leak with the saline, your breast is automatically deflated. So you will have one normal and one flat. Excuse me. With the gel, it's a thicker material, I guess. And so even with a leak, the most that you'll see is a small lump of wherever the leak is at, and that's your sign that there is a leak. And it stays right where it's at. It will not deflate. And there is no, like I said, complications with a leak with the gel. So that's where I think I'm going to go to, but I'm going to do a little more research and check and see what happens there. So I'm just waiting on my 3-week, 2 to 3 weeks for, please excuse me, I'm sorry. I'm waiting on the prior authorization for that, and we'll see what goes on with that. Back to my last video, I had talked about some depression and about my Implanon, which is a birth control stick that's inserted into your arm, and I was having some major complications with it. And we're talking major ones. So go back to that video. I don't want to keep going back and forth and repeat. It is removed. You can see just a tiny bruise right there. It's gone. I don't know if it's in my head or not, but I feel like I'm feeling better already. That was 2 days ago. They did give me a Depo shot, which is a 3-month shot, which hurt like a bitch. Not at the time, excuse my language, but for the last 2 days, major hip pain. Not fun. Feels like a tetanus shot is what it feels like. And on that, I'm not sure exactly what it's called, Essex or something along those lines. I should have brought the brochure out, sorry. Escher maybe. It's a new method for women to have their tubes tied without physically going in with incisions or laparoscopic or in a hospital stay. So I'm choosing to get myself fixed instead of my husband because, of course, he would have an incision. He has one insurance, hasn't met his deductible. I have 2 insurances, mine and his. I have met all of my deductibles, so I will have nothing out of pocket, and there's no incisions, and I'm off for 2 days with cramping and some minor bleeding. So it makes sense for me to get it done. And what they do is they go in through your hoo-ha, and they use these nickel clamps, and they will clamp on each fallopian tube, and it will seal, close. At 3 months, they will go in again with a dye and see if it is flowing through or if they are fully clamped. At that point, I'm not exactly sure what they'll have to do. If it's a small, then they're going to leave it alone and it will eventually close, or if they would have to go in and clamp more. I've heard it's uncomfortable, but and it's about an hour from start to finish, and then there'll be about 4 people in the room, which is just lovely. That's just ecstatic. Whatever. So that'll be done in 2 weeks, and I'm pretty excited about that too. So I'm getting some good news. I did get pink eye. For some of those that are on my Facebook, you will see that. It's actually doing quite well. I don't know. No, you can't tell. This eye in particular was really super pink, and I felt like I had glass in it. This one felt like I had eyelashes stuck in it, and they were getting gunky when I'd wake up in the morning. Just for the last 2 days, and I really never even crossed my mind about pink eye. It was people at work that were like, your eye's freaking me out. It's getting worse by the minute. And so I had to go to the doctor, and sure enough, I had pink eye, which... if you're a Facebook friend, there's a story behind that. While I was at the doctor's office, feel free to look at it. It was quite hilarious. I'm getting short on time, so that's why I'm just giving you the brief over. So I did get to 24 hours off of work, so no bowling tonight. And then I had my appointment with the plastic surgeon. So it's been a nice busy day. And for being sick, a good day to be sick. It's gorgeous outside. It's like 81 degrees out, and sun's shining. It's beautiful. All right, guys, I have 15 seconds left, and I've long bored you for a while. So it's great being back on the laptop, and I've missed you guys. So I hope you enjoyed the video, and if you have more questions, let me know. Bye.